Hi everyone, today we'll be talking about Marfan syndrome. So before we begin with the disorder, you need to understand one thing, that it is a genetic disorder, which means it runs into the family. Next thing, it is a condition happening because of connective tissue or the proteins which are present in the connective tissue. Now coming to the clinical feature, as it is very easy to remember the condition with the pictures. So for first thing I want you to notice is the picture here. See, the arms and the legs are so long in such patient. The torso region is not that long, but the arms, the limbs are very long. Then there is a curved spine, which you could say it is basically kyphosis. So you know what is kyphosis? When there is a abnormal curvature that is seen in the spinal cord, that is kyphosis. It kind of postures. Then crowded teeth, long and narrow face, slender limbs, I've already told you. Long finger and toes are also there, so that could also be seen. Then curved spine, flexible joints, flat feet, abnormal heart sounds. Remember abnormal heart sounds because this is a normal heart, and in the patients who are suffering from Marfan syndrome, there is enlargement of the aorta. Now the three major organs affected here is the eye, lungs and the heart. Now what happens in eye? There is a high pressure in the eye, so due to which the vision gets disturbed. Okay, so high pressure is there in the eyes. Now in heart, I've already told you the aorta is affected. In lungs, because of the sternum, this problem occurs. Now this is a very important feature here. The first feature and the second feature, these are very important. So indented sternum is what? When your breastbone, it moves inside, it's basically sinking inside, that is said to be your indented sternum. Okay, and what is protruding sternum? When it moves outwards, that is known as your protruding sternum. Now indented breastbone or sternum is also said to be the pectus excavatum. This is the another clinical name for this condition. Coming to aneurysm, I hope you all know aneurysm is basically ballooning of the arteries or any kind of swelling which occurs in the arteries. Now because of this condition, there is a high chances of rupturing of that swelling or ballooning of the artery, and it can get rupture, which could ultimately lead to death of the patient. So it is one of the most common reason of death in such patients, which you need to know. Now how to manage this condition, Marfan syndrome? See, as it is a genetic disorder, you cannot treat all the problems at single time, but we can treat it one by one. Like the blood pressure or the eye pressure is controlled, so you need to control the BP in such patients. Okay, the aorta issues or the heart issues could be treated separately. So for every condition, you need a different surgery and medication, so you treat it in such a way only. It is managed like every condition is handled separately, and it is very difficult to handle such patients with so many problems. Now these are some common clinical features and the main etiology behind the Marfan syndrome. It is a very commonly asked short note as well. I hope it is very clear to you in this video. Thank you so much.